So thank you very much for joining this panel. I would like to start maybe by asking you if you have maybe any key points that you would like to share with us from your perspective about policy frameworks for holistic climate and health strategies. And let's keep it short. I think on Sunday, Dr. Gitinji and Dr. Ahmed had a joke about matatu. So yeah, so it's 3 points each before we move on. So I'll start with Mr. Bob Nativu.
Thanks very much. First, let me make 2 disclaimers that I'm not an acting commissioner. I used to be an acting commissioner, but things went haywire. I'm substantively an assistant commissioner. Hopefully, I'll become a commissioner sometime soon. The second point is I'm not a doctor yet. Dr. Charles, I think people have been referring to me as doctor. I also received that with both hands. I don't know whether it's too late for me to become a doctor, but I'll work on it. But I'm really very happy and excited to be here because as a person who actually deals so much on formulating policy and everything else, I am very privileged to be a part of this discussion that kind of talks about the nexus of climate change and health, which in most instances, I'll tell you for a fact, it is something that is in 2 different corners. So health is most likely in the red corner, then climate is in the yellow corner. And this kind of discussion for me gives me hope that probably we can start brainstorming together to see how we can bring this together. If you look at our policy frameworks, the national climate change policies, the NDCs, the national adaptation plans, and so on and so forth, you may struggle to find explicit mention of this nexus. And yet these are some of things that, for example, we talk about at global level to say, look, how do you ensure that countries continuously report after 5 years in the NDCs and so on and so forth? When it comes to issues to do with financing, for me as a climate expert, wanting to access financing from Green Climate Fund, you wouldn't have it easy. For example, to do a solely health curve proposal and you expect to get financing. So for me, those are difficult nuances that I think we need to keep talking about it, but also see how we can concretely take action so that me as a health expert can actually sit with the various health experts to collectively agree that, look, this is not something that we should only keep bound around environment, water, and security or as it is, but ensure that we bring this to advanced sustainable development. Developing policy frameworks and implementation also is bound around then how do you include as many stakeholders as you possibly can. One of the challenges is that most of these things come from external sourcing. And I've been hearing people talking about One Health, whatever, but it is about institutions outside, for example, only coming to deal with Ministry of Health, and yet there is a national entity that actually coordinates national climate. When I come back later, I'll try to explain a little bit more how the few climate and health ideas that we've advanced and we are trying to advance collectively with the Ministry of Health, we are trying to put them to the forefront to see how both these can benefit from whatever opportunities that there are, be it human resource, be it financing, be it collective responsibility, and so on and so forth. So for the start, I would like to stop at that. I'm happy to come back. Thank you very much.
Can you hear me? Okay, good. I wish you, Commissioner, and I wish you, Doctor. We have to manifest, but really nice to hear from you. So let me just start off by telling you a very quick story, and then I'll summarize those three points. Mambo ni matatu. Things are three, okay? The first thing I want to talk about a quick story of Marburg in Tanzania. And then I can comment on this issue because it's actually linked. The story is the story of a young 21-year-old community health worker called Vedastina from a place called Nyakalima. It is at the border of Tanzania and Uganda. Sometime in 2022, when there was an Ebola outbreak in Uganda, CDC, US CDC funded AMREF and they worked with the Ministry of Health in Tanzania to do event-based surveillance training for community health workers. And this event-based surveillance was done, and the community health workers were trained how to do event-based surveillance of Ebola. But then later on, there was some more money and they were trained on electronic event-based surveillance and they were given mobile phones. Now, this particular young woman, Vedastina, 21 years, was part of this group. So sometime this year, 1st of March, a family in this region where she was working had a sick person who had fevers, bleeding, and all these issues were going on. So the family called a local, I don't know how many, boda, a motorcycle rider, came, picked this patient, took to the local facility. Then this facility said, oh, this is too complicated, referred the patient, and the patient died. Then a few, 2 weeks later, the family called the same motorcycle rider and said, hey, please come, we have a few more sick people. This point now was the mother, auntie, 2 cousins, so they took the same route, local hospital, referral, died. In the process of death, this motorcycle rider now, because they know the family, they're from the area, like, hey, that place, there's a very strange disease going on. I don't know what's happening, maybe it's witchcraft, so rumors started. And this training that had happened of the event-based surveillance had also created, the electronic one, had created a WhatsApp for the community health workers to, just talk to each other. So somebody on the 15th of March, one of the community health workers reported these rumors on the WhatsApp group and said, hey, this the family of so-and-so. This is what has been happening. And this particular 21-year-old young woman picked that, and remember, they have been trained on electronic event-based surveillance, went to the app on the phone by 4 a.m. the same night that she had the rumors, reported the case. That's how the Ministry of Health in Tanzania Epidemiology Department knew of the outbreak, got down, case management, all the things that we do that you all know very well, and that's how the Marburg outbreak was identified and managed. Now, therefore, let me conclude my 3 points. 1, that it needs for you to actually create policies that recognize the climate-related public health risks. They need to be community-based. And the community policies need to be institutionalized. That means that community health workers, community health systems, event-based surveillance is not something you do under a project. It's not something that we should do when we are funded by US CDC or by Africa CDC or by who. It needs to be institutionalized at country level, including the payment, training, and the capacitation of the health workforce at this level and linking them to the entire system. The second point is that at national level, climate-related indicators in the Public Health Act, the Public Health Act was done many years ago. I don't think any governments, maybe very few, have actually got back to review the Public Health Act and recognize the current and future risks. So I think that's the other thing that should be reviewed and link this to community and link to disease surveillance and link to IHR and give the public health, the Ministry of Health, more teeth in terms of implementation. And this needs that the countries to recognize health as a security issue. We saw that when COVID came, many of the activities were actually managed by the Ministry of Interior. Putting policies that put health in our policies, but recognizing health as actually a security issue. And finally, at global level, it is making our IHR or the IHR review that's ongoing now, making sure it puts these issues at national and community level to make them contextual and central to the cross-border and also in-country recognition of risks and management of them. I stop there. Thank you.
Yeah, mambo ni matatu. So let me talk of the gaps that I see. The first is policies that are very elitist in nature. We gather here, we talk amongst ourselves, we develop some policies. They have very little connection with what the border rider is seeing on the ground. And when the time for implementation comes, then that gap is also translated to the effect at the community level. So how do we get policies that actually are relevant to the actual situation at community level? This is the first thing. Second is resources. And we have so much local resources. Every time we say resources, we all remember money, which is good, but there are resources beyond money. The indigenous knowledge I was talking about earlier today, where do we get our institutions to play their role? That's a resource. Where do we get our experts to play a role? Where do we get our folklore and our experiences to play a role? Where do we get the money, which is local, to play a role in not just prevention and health promotion, but also in preparedness and eventually in response? And I believe that on the African continent, we have a lot of money. The problem is that it's being placed in the wrong places and therefore does not give us the desired results. So the resources that are local, where are they and how can we be able to include them in the nexus of climate and health discussion? The final one is documentation. We are very rash, no, not rash, delete that. We are very quick to act whenever there is something. But then 2 weeks later, nobody remembers what was done because it was never documented, never written, no video, no audio, nothing. So 2 weeks later, when you start with a new thing, you really start from scratch. And this for me is one of the biggest failures of us on the continent. And that is why when you go to village X, you cannot find trace of what was there before. If it was the first chief of the community, you'll be asked where was the house, and people will start struggling with the tree he used to sit under. Nothing is documented. If nobody remembers it, that is it. But elsewhere, people document, and so you don't start from scratch. So how do we get our experiences to be well documented so that tomorrow, when something new comes, we don't start from scratch, we start from the knowledge that we had gathered from before. Mambo ni matatu.
Thank you.
Just if you may allow to make just a very quick rejoinder to what the two doctors have said in terms of the impulsive responses that we have, be it on health or even on the climate side. In all our countries, for example, we will be quick to act when a signature event like landslides or floods happen in a particular area, X or Y. And I suppose it's the same that you're talking about when it comes to health. So for me, the question that we should be having at the back of our minds, so how then do we have to solve that conundrum? Because even with documentation or whatever, because from our side, you document things on a daily as it happens, but after a year or two, the same thing is going to happen, and then you end up in that same cyclic cycle of 1 step forward and 5 steps backwards. I'm not saying I have an answer, but I just wanted to reinforce the very good point that you made. Thanks very much.
Thanks so much for getting everyone's attention. I think you've all raised some very interesting points. So I think I'll start then with Dr. Gitinji. Dr. Gitinji needs to go to KICC for another meeting. So if you need to leave, then feel free. We thank you so much for making time to come and join us. So you already started by the example you gave us from the community. And my question is, these grassroots initiatives always drive the most meaningful change at local level, as you've described. But how do we take these community-centered efforts that we know work, because this is what happens in the village? How do we integrate these international and global climate and health policies that work? because we're experiencing top down, right? The policies are made by people sitting at the top who don't really know the context of the people, at the bottom. So how do we take some of these lessons at community level and start to integrate them at national, regional, and global levels?
It's partly what has been said here about the fact that we don't value local knowledge. And that's what Dr. Hamid was talking about. If you look at evidence now, if you're working with any of our institutions and they ask for evidence, what they mean by evidence is what is published in the British Medical Journal or in the Pan-African Medical Journal. That's what evidence is. The evidence of this motorcycle rider, according to the people who define evidence, is not evidence, because it's not peer-reviewed. But this motorcycle rider has a story about how the communities live, how they behave. If I'm sure there's a story beyond this community health worker, there's a story with that motorcycle rider in terms of how they live, probably events even before this happened. This story is, I was telling this story because this story is linked to climate change. Because the Marburg outbreak in Tanzania and Equatorial Guinea was related to movement of bats in areas that were warmer, that were not warm enough before. So it's related. So there must have been evidence from the community on this movement. And the community sees these things all the time. Oh, we didn't have bats, now they're here. If you talk to people now on malaria and the impact of climate change on malaria, they'll tell you, actually, we never had, and I've talked to many, we never had mosquitoes here, but now we have them. I was talking to a governor from Nairobi, and he was saying, the mosquitoes we had before, they used to come from up here. They come down, you kind of switch them away, they go back. The ones you have now don't go anywhere. They just duck you. When you're trying to do this, they go around, they go under the table. That's community knowledge, but it's not peer-reviewed, it's not published in the BMJ. So the question is where the policies then come from. What we tend to do is that our data documentation in this continent is largely driven by funded projects. That's why when you look at the Global Fund and they're doing work on malaria, HIV, TB, but where is that data? That data is sitting outside the DHIS2, the District Health Information System. You have data on malaria, on TB, and it's sitting elsewhere because it's not integrated. So the question is, how do we actually drive the systems ourselves? And those systems link to the permanent data. And those systems, the data includes qualitative data from communities. We have structures in the health system that ask for quarterly community meetings at facility level that are two-way from the health facility to the community and back. They don't happen because they are not funded. Because everything that happens in our health system has to be funded by a donor somewhere. So I think this is really what we need to reverse and say, let our health system and our health financing be community-driven. Let the funders fit into the health financing agenda, because then it's driven by the country and the funders are coming to help one policy, one budget that has embedded systems. So it has to come from grassroots upwards, and then make sure that those structures are funded or they are actually financed by the country. The funders are just assisting the country strategy, and the national is what should inform the global, not the other way around. Thank you very much. And therefore, I'll sneak out, and I hope you'll allow me to.
Yes, thank you so much.
Thank you very much.
Let's give Dr. Kitinji a round of applause. So we've heard from Dr. Kitinji that it must come from the grassroots, that the community is important, that they have knowledge, and we often underestimate that knowledge, and also the element of ownership, which was raised earlier. So he also spoke about our health systems and the need to have an integrated approach. So I'd like to ask Dr. Ahmed, Africa CDC is doing a lot in terms of disease management and response, and supporting our health systems and health workers. And we've recently branched out to start supporting the growth of a community health care worker program. And I just wanted you to give us a little bit of insight on this and how this can contribute to our effective response to climate and health challenges on the continent.
Thank you. And really, although Gidinji has stepped out, the core of what we do has to be felt at the community level. If it is not, then all that we are doing becomes relatively academic and does not touch on the vast majority of. So the work that AMREF is doing with community health workers, very big kudos to AMREF. Now, on our work as Africa CDC, we have done a few things. Our mandate is largely coordinative. That's really what we are supposed to do. But because of the huge gaps, then we end up doing direct support. We are in the communities as well across the continent, but that is because there are gaps. The day that we have our national public health institutes and the infrastructure at national level able to do the response, then we'll be doing more of the coordination. So there are several things that we've done that would contribute, when properly used, will contribute to the discussion we are having about this nexus between climate change and health. There are continental frameworks that we've developed. We have developed them in antimicrobial resistance. We've developed them in One Health, at least relevant to what we are discussing here now. We've developed them in in establishing of national public health institutes. These frameworks exist. And what we are encouraging our member states to do is take the frameworks and then domesticate them into policy, into law, into action, so that we can be able to benefit as a continent. So these frameworks are available, and we continue to refine other areas, including surveillance and laboratory systems, so that our contribution as Africa CDC becomes continental in nature and supporting our member state. Second is we are building capacity across the continent. In the morning when I was speaking about the lack of this cadre of climate experts are here, public health experts are here, there's nothing in between, very apt as we sit here now. We need the in-between. Who are those who are from the climate expertise who will be able to learn enough of public health to be able to bring the two sides together and vice versa? So that capacity building, again, is our mandate as Africa CDC. And we have developed, especially during COVID, platforms and the modules for engaging different levels of expertise from the top all the way down to community level. We must build our own capacity in a way that contributes towards our challenges here on the continent. And finally, as Africa CDC, we have access to policymakers, much more than many other similar institutions. Although we are the public health agency of the continent, we are also a child of the African Union, which means that we will engage with all levels of policymakers, from the technical to the ministerial to the heads of states. Using those platforms, we are in a very good and unique position to be able to marry the technical and the leadership of the continent a level conversation. And we continue to do that, and we use every opportunity that we have, especially when we have an outbreak of any sort. We use those opportunities to bring the conversation to our heads of states, to our ministers, to our senior policymakers, senior technical people at country level, to the National Public Health Institute forums, so that we can have them understand that the gaps that we have, if they are fixed, we'll have less problems coming out of any disease threat that may come onto the continent. So these are some of the opportunities that we do have as Africa CDC, and we are committing that we'll continue to make those available to health, to climate, environment, to animal health, etc. Whichever topic may need to be discussed and it affects human health, we are willing to facilitate that.
Thank you so much, Dr. Ahmed. So, Mr. Natifu, my question to you is, the linkages between climate change, public health, and water resources are evident in Uganda's integrated governance approach. So how has your government managed to leverage this approach, not only to address issues, but also to promote sustainable development in the region?
Okay, so I think since morning you've been hearing how climate change affects people's health, and in so many ways. For me, I think I'll just zero in on two where I think we talk about changing the seriousness or the frequency of health problems that people are faced with, or talking about creating new and unanticipated health problems. The first time I got an idea about the link between climate and health was when we were doing the National Adaptation Programs of Action, where we were discussing with various people in very different ecosystems. And in the highland areas, it was evident that global warming is actually causing attitudinal shifts of mosquito habitats. I think the doctor was here, talked about it clearly well. So from that point of view, I started seeing the linkages between both subjects on the same divide. But I think to demonstrate this a little further, the second interface then I had, you can imagine that was National Adaptation Programs of Action so many years ago, 2007, which we submitted our first adaptation plan. Right now we are talking about National Adaptation Plan, which is the medium to long-term interventions that we are looking at. The first one was just immediate actions or quick actions that countries could do to kind of address resilience and well-being. But I want to illustrate my point in answering your question when talking about a project that we've implemented. And I'm sorry, again, this is, you can see everything, health, climate change seems to be externally financed, but I think that's what it is. An externally funded project through us as Ministry of Water, and this time not through Ministry of Health, which is called Climate Change and Health in Sub-Saharan Africa, a case for Uganda. I'm sure you being health experts, maybe you've had an interface with that. And it was implemented by a local NGO. And again, here talking about how do we bring in different stakeholders. I think this is where we are, working with a local NGO called Climate Change Adaptation and Innovation, trying to enhance the ability of national health systems to prepare to and cope with raising needs that playing out, but also with a specific focus on the sensitive diseases, borrowing from the NAPA experience that we had. But I think it comes to a point where you clearly see that despite the good approaches that Uganda has taken, successful as they may be in terms of policy measures and the responses or the strategies and plans that we are talking about in the health sector, these are still in the infancy stages. Even if you talk about now, you're trying to embrace this one health strategy that we are all talking about. But this particular project, I think, tried to fill the gaps that have been existent within the health and climate nexus for quite a long time by trying to identify and ranking and documenting key climate sensitive diseases beyond what we had discovered in the National Adaptation Programs of Action, developing forecast model on climate change and disease risks that runs as a web and smartphone application for use by health facilities. I think the previous doctor also talked about how then do we ensure we get these services closer to the people. So these kind of applications have come out very strongly. Of course, there's also a downside to that. How many people can have direct access or use these applications as we know them, which again calls to how do we ensure we strengthen the capacities, as Dr. Ahmed has been emphasizing, but also ensuring that it doesn't only talk about or respond to the elitist challenges as we know them, but something that we put out to respond to community challenges and improving individual well-being and livelihood of all the communities and the different stakeholders. So in terms of policy formulation of health and climate change, I think government has really come out so strongly on that. The only problem is then how to, Dr. Ahmed has talked about challenges being financing, but for me, I think I still believe financing still remains a very big gap that we must deal with. As I said earlier at the start, I cannot work with Ministry of Health and try to submit a proposal to Green Climate Fund, which is supposed to support climate action across the divide, not only environment, but for you to access financing to specifically support health sector, it will never succeed. So maybe this maybe calls out not just reform into the country-specific policies as we know them, but also the global policies that actually shape the responses that we need to see in our specific countries. I'll stop there. Thank you.
Thanks so much for giving us a good example of a country-led policy formulation and also financing. So it's great to hear that Uganda is making progress. And you've also raised the issue of the finance gap. On Sunday at the dinner that was hosted by AMREF, by Desta and Dr. Gitinji, the Minister of Health from Malawi said sometimes getting financing for health and climate change is like the road to heaven. It's very narrow and the door is very small. And so sometimes these big funds that are made available by the Global North, it's almost impossible for a country to get access to those funds. But then there's still the element of us as Africa completely depending on funding from donors, which was touched on by Dr. Gitinji. So, Dr. Ahmed, if you'll let me come back to you, we've just heard the perspective from a country level. From a regional level, what do you think our position should be for climate and health in terms of regional policy, and then in terms of a position that we can contribute to in the global discussions that are being held now this week, but also in the preparations for COP28?
Africa being the continent that bears currently the biggest burden of the effects of climate related health challenges, if you want, in general. In my view, there are a few things that we must do as a continent. And the first is to make the discussion around health one of the agendas for climate change platforms. We are right now looking at it very peripherally, and doesn't come at the center. And you're right that if you went to look for funding from all the different streams of funding within the climate portfolio, health doesn't qualify. And this, for me, is a problem. And as Africa, we need to make that firmly one of the issues that the continent should push, that health is at the center as an agenda within the climate discussion. This is one. Second is we need to start looking inwards a bit. Apart from generating our own information, our own evidence, building our own priorities, we need to start financing those priorities, because we do have some resources, and it's really unfortunate that a lot, if not most of some of these initiatives that are related to climate change and health are being funded from outside. We do have the opportunity as a continent to finance some of these initiatives locally. And we need to do that as a continent very, very deliberately, particularly during this time when the effects of climate change are being felt by everybody, and therefore availability of resources becomes constrained with a lot of competition. So making the financing locally available is important. We have to look not just at government taxes, but also at the contribution of the private sector and individual citizens across the continent. This will be the second. Third is, how do we, as a continent, start being innovative and generating actual solutions that are Africa-centric. They have been Africa thought, Africa developed, and then Africa implemented. We too often are waiting for solutions to be made elsewhere, and then for those to come and then we adapt. It is time that we change that. We did our own research, we did our own development, and whatever solutions that may be required on the continent, we start developing those here on the continent. Finally, is the need to very deliberately break down these silos of environment, of health, of human health, of animal health, of finance, of policy, etc. We need to break down those silos and start getting all the different sectors, all the different areas of expertise, speaking as, African voice, one African voice to address the climate-related health challenges that we are facing. If we don't break those silos, then unfortunately, we don't have the luxury of doing things in parallel. Others may do because they have the resources to do that. But then for us, when you have a conversation amongst animal health colleagues and human health and environment, then finance, those are 4 different meetings. It could have been one meeting and saved us a lot of time, a lot of resources. So these are the 4 things I would say that the continent can be able to firmly put as priorities for us to be able to take the climate change discussion in a direction that is actually beneficial for the continent.
Thank you so much. I just want to give the opportunity to everyone to contribute. So please do raise your hand if you have any questions. Dr. Judy, please go ahead.
Thank you for a very informative session. This is clear. Very informative session. And I just wanted to make a comment, maybe a question at the end towards a request to Africa CDC. Science is an enterprise, it's a business, and it's a multi-billion dollar enterprise, especially in this continent, because a lot of research in the area of science comes from here. Our people are used, our diversity is taken advantage of, and somebody funds it, even if our government may not have the money. Somebody funds it, and it's a multi-billion dollar industry. The problem is that many areas of science are now threatened or have always been an extractive industry. So we need to really make sure that we onboard the things that we can make ours. And Dr. Gidinji spoke about publishing. And I'd like to say something about publishing, because this has been a chain around our nexus scientists around the continent. We are fighting to publish in journals that even when you publish inside, you cannot get access to those articles. And the future for publishing in Africa really must be open science. Let's look at how we can allow African researchers to publish in areas, in places where it doesn't cost you that much. You can put your information there. And I think, and then have it available for people to look at, so that we are not fighting to hide our data. We're not fighting to protect our information, our research results from somebody else. We can own this by looking at ways of making sure that our information, our research is actually published on the continent, and that we build our own peer review system. Peer review is so important. It's the only way that the quality of science is maintained. Your peers review your science, and our peers must be our African scientists as well reviewing it. So allowing open science with open peer reviewing processes and availability of information, and looking how we can support open publishing platforms for African researchers. In the area of climate health, as the 7th assessment cycle starts, the story is everywhere about how we don't have African writers. It's simply not true. The era where we didn't have capacity in Africa to write about our things is long past. It's simply not true. I think it's support for simple things like subscriptions to certain journals. They start from there. I don't have a subscription for a journal. These are small things that actually government can be asked to support, or with partners we can ask for support for writers, building writing team, bring in the research community to answer the questions that Africa CDC needs to answer. And just to say that we're here. The research community is here to hear from you, say this is how we can help, and how we can even train writing teams to put together that agenda on the interconnectedness of climate and health and the environment, so that going forward, everybody knows what the priority for Africa is, then we can go for funding, knowing what priorities are, rather than expecting research to respond from the other side and trying to apply a retrofit to information. Thank you.
Thanks so much, Dr. Judy. So, Dr. Ewande, our take home is that we have to write about this meeting. Because if we fail, then we're joining the crew that does things and doesn't document. So you can all look out for an article about this important engagement. Do we have any other comments or questions? Okay, yes, we can. She can start because she wanted to speak earlier and I didn't give her a chance. Yes, okay.
Thank you. Thank you so much. Yeah, thanks everyone. I had a question earlier, but this question goes to any panelist in this room. And one panelist earlier talked about effective communication. And in this room, when we speak, we all understand what we are talking about. And I always think about, one gentleman talked about the bush meat eaters. I wonder how should this information we talk about go down to the bush meat eater and know that this is as a result of climate change, and what are those good practices in place, or what can be done to ensure that no one is left behind in terms of communication on climate change and health nexus. Thank you.
Thanks so much for that question. So can I come back to our panelists? We'll start with you.
Okay, so thanks very much. I'll start with Pesh's question first, and then I'll go to Dr. Judy's, because hers, I think I want to frame it in terms of my key takeaway. In terms of effective communication, I think you're right. My first attempt at doing communication, I was told that if I whispered to Dr. Ahmedi and I asked him to whisper to the next neighbor, by the time it gets to the person in the interpretation room, it will have a distorted meaning. And that's true. And it even makes it worse if it's a subject as complicated as climate change and health. So how then do we unbundle this? I think part of the reason is some of the things that we are beginning to do now, bringing the two groups together to see how we can speak about this and identify the challenges, but also create change agents in the different communities. That same dilemma that I talked about, me talking to Dr. Ahmed, and by the time it gets there, it's all so distorted upside down. And maybe the other thing is the importance of documentation. And thanks for taking on the challenge, but maybe that's just a starting point. To Dr. Judy, I think she makes very fundamental point in terms of how to protect researchers, how to promote all this in our different spaces. When she talked about it, I thought about it and I said, hey, wait, as government of Uganda, we normally pay yearly subscriptions, for example, to the NFCCC. So why can't we begin, for example, thinking about paying subscriptions that you talked about? But that can only come if there's this continued interface, not just me from Ministry of Water and Environment, but maybe interfacing with other different scientists and academia to say, look, I think our future solely relies in protecting this that we call as a commodity that is going to help us take the bold step forward if we were to address the challenges that we are faced with. Thank you.
Thanks so much, Dr. Ahmed.
Yeah, I think I'm not so sure there's a very clear response to that, but I'll give you an advice that I was given when I worked still at the Ministry of Health here, and one of the ministers brought us all together, senior management, into a room, and she says that if you're sending a brief to me, make sure that your grandmother can understand it, because then I am going to speak with your grandmother out there. So she was the interface between us, the experts, and the community. And we had to break down our briefs to as simple a message as is possible, something that is very difficult for researchers, for these scientists here, for the public health colleagues, very difficult to break down the the messages. So for me, it is for us to get our communicators to understand our message, and then they can be able to take it to their peers or their communities, whoever it is that we want the message to go to. It's a specialized area. Not everyone can communicate. Many people have knowledge, but not everyone can communicate. So how do we ensure that our communicators are part and parcel of what we do? That for me will be investing locally in our communicators. To research, let's make sure that she comes to the Conference for Public Health in Africa, give her a very active role so that she keeps very busy during the 3 days, so that you can see that a movement has started on the continent where our experts, our researchers are coming together. We have a journal, which is, I think it is completely open source, where we are encouraging publishing to be able to be done. But that's the beginning. How do we get to the young experts to be able to appreciate the need to do research, the need to actually, writing is difficult, leave alone reading. Writing is difficult, and people need to be trained to be good writers, even to just want to start writing. So we need to start that very early in school, and as people grow up into becoming professionals, then they develop the habit of reading, not newspapers, or, these days we do 140 characters reading. If you give anyone anything about a page, they tell you reduce it to half. Now imagine if you're going to do an article of 4 or 5 to read. But then the writing is also a skill that needs to be developed. So we need to start it early and grow it. And institutions like ourselves as Africa CDC, this is her job as the head of science, to make sure that we are actually getting scientific thinking, scientific reading, scientific writing into the way that our public health our colleagues engage with their work on a daily basis. So it is work in progress, and it doesn't have to be funded from outside. It is work that the way we buy newspapers in the ministries, the way we buy milk and sugar for tea is the way we should be buying space for people to read, whether it is libraries, whether it is journals, whether it is whatever the platform that is required for that to happen. Thanks.
Thanks so much. So we had a question from Mr. Kutane, and there, the lady at the back, sorry, I've forgotten your name.
Masika.
Dr. Masika, and then Dr. Monique. And we've got a new colleague in the room. So we'll take those 4 questions and then come back to the panelists. So please go ahead with the question.
Thank you very much. It's a sort of question and also just a sort of comment from the experience. On the financing issue, which is very critical, as I don't know if I have mentioned in my presentation in the morning. As of today, it is 0.05% from the climate funding mechanism. This goes to the comfort zone. Who is deciding at the global level? Who is deciding at the national level? In the national, there is what we call NDA, National Designated Authority. So these are the one who is deciding on this funding mechanism, especially the National Designated Authority, sitting in many countries in the Ministry of Finance in the economy or in the Ministry of Planning. Let me bring one of the lessons in Mozambique. We developed $1 million USD on the Green Climate Fund. And finally, we approach through Dr. Edward, who is now the Director of National Institute of Health. We went down to explain to the National Designated Authority with her team. So first we started with the VA report we have. We summarized like in 7 slides, the VA, and to explain to her how health is affected by the climate change. So after this presentation, even the response was not the proposal we developed. The designated authority, she said, health should be part of the committee who is deciding on the climate funding mechanism. So now, the people who are deciding, as I said, they prefer their comfort zone, what they understand. So everybody does not have every knowledge of everything. most of the time, the health people, they don't sit in these, even at the global level. So I'm not going to tell you the organization. Judy, when you come there, like before 10 years, I was discussing with one of the big organizations, and they told me, we are focusing on our comfort zone. The person who is responding to me, we are focusing on our comfort zone. For me, I'm coming from the agriculture and the water, so I focus on that. So really, this is a very important where we need to raise the knowledge and then the information. To do this, two things. One is having the vulnerability and the adaptation assessment for the health. When I said the vulnerability and the adaptation assessment, it's not only about death and the disease. It covers all in this. I didn't show you the methodology because it has a fancy, these mathematical models in the morning to generate those vulnerability index. It covers everything. So we need to have for the country and covering the local level. That is very important to convince the people. The second one is the National Adaptation Plan. There is adaptation plan for the country. We need the health national adaptation generated based on the evidence from the vulnerability assessment. The third thing, we need the health in the national designated contribution report. For example, in the last year and before last year, we produced the health report is well covered for Mozambique in that. So these are the three things in the climate for the resource. We need to have the VA, we need to have the health national adaptation plan, which mainstream the climate change and other environmental determinant of health to health program, and also have the report of health in the national designated contribution report. So these are really very important areas which I want to comment, and also for if the panelists respond to that, it's okay. Thank you very much.
Thank you so much. I'll add one more. You need to write about what you did so everyone else knows how you did it.
It is already, I shared this one with Dr. Yaounde, the lesson documentation, including the beneficiary's voice. I didn't include it. In the research, we need to include, if we want the research to be used as an operational, we need to include the voice of the beneficiaries, the community. So I shared that with my presentation, the lesson documented on Mozambique. I think it can be put on websites. It has been already edited by our colleagues also in Geneva. I think it's good that lesson can be shared. It started with the policy and end up with the beneficiary. So we will see. But luckily, we have a little bit problem on the resource. We stopped this work is we are struggling. I'm back now to Ethiopia. We are struggling by distance with the Mozambique colleagues. How this thing can be continued in the future. We don't need to stop. Because of the project nature, we don't have funding to move, but we generated the lessons, and which I have already shared with the Dr. Yaounde and the Dr.
Thank you so much. So Dr. Wande will share with everyone so we can all benefit. But thank you so much for that perspective. Dr. Masika, your question?
Thank you very much. Daktari amesema mambo ni matatu, but yangu ni moja. So I'll just stick on financing when it comes to the global policy frameworks that we're trying to identify to bring in the nexus of climate-related issues and health. I want to bring in the issue of the role of equity and solidarity when we are at the global framework. I know some of you are already part and parcel of the process of the pandemic instrument to the WHO, and one of the key issues that we are seeing in this process is the global south. There's a bit of resistance or hesitation rather from the countries from the global south, because most of these processes are they're looking at it as a point of inequity, and especially on the One Health framework, because as we've already mentioned, One Health is, yes, it's a very good framework, because as we've already mentioned, One Health is a very good approach, but it also brings in a potential of it being an approach that promotes inequity. And we saw this during the COVID pandemic, where the countries from the global south were very much disadvantaged in the sense of manufacturing of vaccines access to the African continent or the global south continent. So what I wanted to bring to the panelists and see how can we be able to address the role of equity and solidarity, especially, and as much as we are saying the global south needs to put in some money in prioritizing the health sector, for a larger extent, this financing will not happen from the global south nations because our priority and our problems are so many in comparison to the global north. So how do we bring in this, ensuring that these global instruments address equity, and with actionable text within these instruments that we're working on, to make sure that there's proper financing for countries within the global south to implement and operationalize One Health, keeping in mind the principle of common but differentiated responsibilities. Thank you.
Thanks so much. I'll take the other two questions. Dr. Monique.
Yeah, thank you very much. I just want us to move back because sometimes it's good to look back before you look in front. And I want us to go back to the pandemic, COVID-19 time. I think we saw the Africa CDC really lead and showed the interaction between Africa CDC and the heads of state. And they were, you were able to really take leadership. And when you spoke as Africa CDC, the presidents listened, and as the citizens, we acted. So there was that synergy that was so good that things just happened. And policies were made very quickly, quick turnaround time, and there was action. So I am asking, in this climate crisis, can we take that, what worked best for us? Can we use that? What was that magic that was there during the COVID-19? Because we were supposed to be dying in the streets. There was no vaccine for us, but somehow through Africa CDC and our governments, money was found, vaccine was found, citizens were vaccinated, and we were trying to break the silos. So I want to ask Dr. Guel, do you think that you have the same response now from the governments? And if not, why? What should we as citizens do to bring that, to recreate that momentum? Because I think if we don't relive that COVID-19 pandemic story, we are losing the climate crisis. Because you can even imagine health is not in the agenda. And here we are talking about all these things. So
thanks, Dr. Monique. And our last colleague here, please introduce yourself.
Good afternoon, everyone. My name is Lucy Murithi from the Financing Alliance for Health, an organization that supports government with technical advisory when it comes to the area of health, primary healthcare financing. So just building, I will add weight to the question which Dr. Ria has raised. And when we look at the COVID, community health played a key role in containing the disease. And it's unfortunate that mostly we classify community health in health only, and we have left it out in the area of climate change. But when Dr. Githinji was speaking, he was very clear on the role that community health plays. And I remember Dr. Agnes also in the previous panel speaking of getting the climate literacy to the community level. But do we have community health in this panel? No. Do we have them in the main climate agenda? No. So how do we intend to reach the community where all the challenges that we're experiencing originate? Because they will be the first contact with the community when it comes to disease surveillance. Zoonotic diseases, they will be the first people to report dying animals or dying cows in the village. They will be the first person to report of open defecation, and all the trees that are being cut, they have direct contact at the community where all our challenges originate from. But they're not in the agenda. And when we sit to make decisions, we need their words. We need to hear what their perspectives are. So what are we doing to ensure that these people are heard? Thank you.
Thanks so much. So let me come back to our panelists so we can wrap up this session. So Mr. Natifo, I'll ask you to answer the question on financing on issues of equity and solidarity and access to the Global South.
Okay, so thanks very much. And thanks, Dr. Kitune, for this question on finance, but also the complications that you've cited around the NDA and then the internal mechanisms that we have in country. I think to be fair, let's go back to how the climate response has been framed globally. The way climate response has been framed is bound around two frames: adaptation and mitigation. Where adaptation, we are talking about how do you then devote resources, for example, to improve people's well-being, so to speak, or to save them from a flood, say dam building. And the second point is the mitigation one, where we're talking about emission reductions from our perspective. But when you include the perspective of health, actually, it's much more different. In fact, I've just seen here on a slide, I think the previous to present zoonotic diseases come about, and I saw something that has a direct correlation between what we do within the environment, the landscapes that we have, forests, trees, and everything else. From my climate perspective, I'll not so much look about that outer layer implication of zoonotic diseases. I'm so much interested in the emission reductions or the accumulation of emissions by the land use change and land use change practices that happen. So which blinds me to the fact that, okay, once there's this land use change, there's also this other outer layer that actually has an implication on health. So that alone clearly shows you how complicated it is to even begin getting finances for specifically health, because if you go to GCF, their interest is how does this respond to emission reductions as point number one. But again, with interactions with the various health experts, I think then this can be even explained a little further to add in that layer, which actually negates the overall well-being that we are talking about. Because if you look up at the national policies that we've framed, we all talk about low emission development pathways, but generally ensuring that we improve individual livelihood and well-being. And health is part and parcel of improving individual livelihood and well-being. So how do we access climate finance in country? He's right in what he's talking about. This is something which is vested within the Ministry of Finance, of course, working with us who set like the climate change agenda. But again, you can see it's just two parties playing around, the climate side and finance. So health, unless there's somebody who has a louder voice than myself and Dr. here, will keep a blind eye. So I think the discussions going forward is about how do we bring everybody else into the fold. It's not that easy, but I think this repeated talk about it probably at some point will yield a bit of results. On the role of equity and solidarity, I don't have, honestly, a direct answer to that, but I know I can only speak to what she spoke about on the issue of common but differentiated responsibility, because we have those same principles within the climate discussions that we have. Whilst there are those principles of CBDR in the climate discourse, but also in the discourse that you've enlisted, I think what we have to bear in mind is that there is not any financing that there is being provided for at global level that you're going to get at no cost. So I think the point from our side we're talking about is how then do you ensure maybe the cost of getting that financing is actually allows you not to make you slide further into climate debt, but allow you address the aspirations as you've enlisted in your carbon management plans on one hand, or even the policies and plans that you've set forth. The last point I want to talk about as a key takeaway, I think, is the more interactions between us on the climate side and health. Nationally determined contributions. Initially, these nationally determined contributions were aimed to be submitted every after 5 years. But with the assessments that have been done, submitting plans every after 5 years will lead us to a temperature rise of below 3 degrees, which is a bit dangerous. So countries have been encouraged to submit these plans every after year. So how then do we ensure that health experts are part and parcel of that? Because now that's going to be the starting point of ensuring that we have a health chapter within the nationally determined contributions, which, by the way, we have health chapters in IPCC reports as we know it. But when it comes to domesticating these downwards, now it takes the opposite direction. So maybe there's something there that we are not talking together in response to what is already set globally, but I think the idea to have, I think, health experts be part and parcel of the climate discussion is what is going to help us in part of ensuring that we all move at the same speed, but also make sure we take advantage of any opportunities that exist, not only at international level, but even within the national spaces. After all, climate change is something that we are going to talk about for the next 20, 30 years. And I think it's the right time for us to begin doing this as we do it. Thank you very much.
Thank you so much for those remarks. And I'll move on to Dr. Ahmed to respond to the last two questions, which was how do we leverage on Africa CDC's convening power to champion the discussion on climate change and health? I think Dr. Monique wants to see the president's meeting 17 times a year. So how do we do that? And then the next one was community health workers have proven to be a key element in improving health outcomes. How do we extend this to the climate change and health nexus?
Yeah, thanks. But allow me to touch on equity, especially with the experience we had with the COVID-19 vaccines. There is no way that one can be able to respond effectively if they don't control the tools of response. And for us in human health, the tools of response are all those medical countermeasures that we need for early warning and for actual response if at all an outbreak then comes. We didn't realize the power of coming together until when COVID came. And I'll pick only vaccines because that's what you've picked, the question that you asked. Today, Africa manufactures 1% of our human vaccines needs. 99% is manufactured outside. If we look at the routine immunization, well over 60% is funded by others, probably much more than 60%, but well over is funded by others, meaning that Africa does not manufacture its human vaccines and Africa does not fund immunization for its children and even adults when it comes to health emergencies. It puts us in a very vulnerable situation. So during COVID, because there was panic buying and whatever vaccines were available were bought in advance, as a continent, we were tasked to go and find a solution by our heads of state. And Africa CDC was secretariat to that, what ended up being called the Africa Vaccines Acquisition Task Team, which transitioned into the Africa Vaccines Acquisition Trust. What happened is, because we had a little money, it was not very little, $2.5 billion is a lot, and we could not buy the vaccines from anywhere because they had all been bought. But when we engaged with the manufacturers, they realized now these are serious people because they have come with a little money and they have come with a need and they were willing to negotiate. We will sit up to 1 a.m. in the morning negotiating because these folks were all in the Western Hemisphere, which is many hours behind us, but for their convenience, you'll stay up late. They realized that we had something on the table. So if we get focused, equity is not given. Equity is taken. It's just like power, they say. If we don't organize ourselves and go after what is our priority, then equity will remain on the lips of meetings. It will not get down to the communities who really need them. So for me, equity issues will always be the one who is the most vulnerable, organizing themselves and going out there to look for what is rightfully theirs. And I'll leave it there before I become too political. Now to this other question, Monique, our heads of state, and I hope I'm saying the right thing here, our heads of states are very reasonable people. Very reasonable people when you get them into a room and you're speaking with them, very reasonable, and they also make reasonable decisions when they're given the right information. Today, as was given to us 2 nights back, and I was very surprised, it was the first time I was hearing that the climate subcommittees of cabinet, other than one country, all the rest were saying health is not around that subcommittee. And we are talking climate issues here, but health is not at ministerial level. So it means that when decisions are being made, those who are making the decisions don't have the right information. And when our heads of states have the right information, they make the right decisions. They made big decisions, establishing the Africa Vaccines Acquisition Task Team, making sure that Africa CDC had the initial, I think, $65 million for us to be able to respond. Directing that factories were repurposed to be able to manufacture the medical countermeasures that we needed. They did a lot. I mean, they committed to the Africa Vaccines Acquisition Task Team to $2.5 billion worth of COVID-19 vaccines to be purchased through Afrexim Bank. So they do make reasonable decisions when they're given the right information. The question is, what information are they getting before they make those decisions? That's the momentum you're talking about, and that is our role as Africa CDC and the Africa Union to bring those issues to the table. We are convinced under the new public health order that if we don't make our health security a priority, then we'll always rely on 99% of our vaccines being manufactured outside. But if we flip it, as we've been asked to do, then it becomes a local problem looking for a local solution. So we need to give them that right information. And that's as far as I will go because there's not too much time. Getting our heads of state to be well briefed and to be given the right information. And we have multiple ways of doing that. Those of you who have access to the first ladies and the first gentlemen, I assure you that's a very, very good route. Please use it. The second question on community health workers, I think it is the least appreciated public health tool on the continent, community health workers. They are the ones who can flip things in a matter of hours, and they are the ones who are the most neglected. Most of our countries don't pay them. They'll be given a blanket here and, cooking oil there, but then they are not remunerated on a regular basis to be able to engage with the communities in a comfortable and consistent way. So community health workers, we must deliberately make them the tool of choice for this continent so that we can always be able to access our communities in an effective and fast way when the need arises. And how do we do that? Again, we go back to our policymakers. We ensure the policies are friendly to community health workers and therefore our own worker within the public health space. But we must expand their engagement. When we are asking climate, the environment side, to work with us from the human health side, to work with us from the animal health side, we also need to ensure that the community health worker has knowledge beyond a few diseases and a few risk factors. We need to empower them to be able to communicate well when there's flooding, when there's a drought, etc. They also provide that kind of information that is required using traditional knowledge, using a well-tested scientific information, whichever is going to work for the community. We need to support them and then give them the right tools to be able to work with. I think that's what I would say to the community health worker piece. Thanks.
Thank you so much, Dr. Ahmed. So we're going to end this session. I'm sure there's more questions, but we still have our cocktail session and our networking dinner. So feel free to continue the discussions. So just a few key takeaways from this session. We heard that the community and grassroots should direct the national and global level, not the other way around, that indigenous knowledge is key, that documentation is critical at all levels, that evidence generation and the role of scientists is critical, the issue of access and skills building, that multi-sectoral collaboration is key, that financing is a big gap and it needs to be addressed, and we must factor in equity and solidarity, and also that we need to think about access to policymakers and inclusion of community health workers as a key way of advancing access to our communities. So let's give our panelists a round of applause. So I have the privilege now to call on Dr. Wande and Desta from AMREF for an interesting fireside chat. So a round of applause for them.
Madam Deborah. Thank you. It's been an interesting discussion. You would agree with me. First of all, a big round of applause for yourselves. I don't expect, usually by 4 o'clock, I don't expect questions, but it's been interesting questions. So, I mean, it means we're saying something. We're speaking the right language. We know what we want as Africans. So I'm quite pleased to have both amazing women, Desta from AMREF and Madam Deborah from AFDB. A lot of your questions have been around money financing. And as they always say, money does make the world go round. So I'm coming to AFDB. Madam Deborah. Dorobas, thank you. So there's been a lot of, AFDB has really shown how public-private partnerships can work, and has really led conversations around investments in Africa by Africa. And I mean, we as Africa CDC, we have worked very closely with you, and I'm sure many other partners in the room. I'm keen to understand how can we really leverage the scarce resources available in Africa to really ensure that we have enough resources, investment to really drive the climate change and health agenda on the continent. So we'll start with you.
Thank you. Thank you so much. And thank you for the invitation. I want to start by saying, we know what our issues are as a continent. And I believe we know what the issues are as a country. I think what is important to be able to maximize on the, I don't want to call them limited resources. I think we have a lot of resources. The problem we have is we do the work in silos. And because of that, the operational cost becomes even much higher than what we would want it to be. So I think for me, and maybe for the Africa Development Bank, one of the things that we need to be looking at is, how do we use this One Health approach to be able to design programs that will actually address the issues as they are, not in isolation. I think that has been a big challenge, and I'm looking forward to seeing opportunities where we could actually work together in a way that we don't get resources from one angle and use it for one particular thing, and then we go to another development partner and get another resource and use it for another thing. And in most cases, you find that the two projects are not even talking to each other. I think as Africans, we need to take that responsibility and drive our own agenda and use resources according to the needs within our continent. That's what I would suggest. Thank you.
Really good, interesting start, I must say, especially when you talk about design and interventions. A lot of the conversations we have had today is really about the problems, the impact. But it's really good to start thinking around what programs, what interventions do we really need to do to mitigate the harm of climate change or the impact of climate change related health. Thinking about things like, should we be stockpiling for vaccines? When El Nino indicators can predict certain disease outbreak, like Rift Valley, for example, that's a way to look at it. But a lot of conversations around financing, and I'm going to come back to you. One other thing that's coming out in our conversations is, how do we tell our story? And I think one of my previous panelists already kickstarted that. I'll come to you, Desta. And given your role, I know you've done a lot of work around advocacy and really shaping the messaging around global health, how Africa should really prioritize its own needs and really take the stage, the center stage of the story. How can, advocacy around climate change has really evolved. Now we're seeing a lot of films on Netflix around climate change. But when it comes to the nexus on climate change and health, there's still that gap. How do we make sure that the advocacy is aligned, and how do we tell our story?
Wow. So I think, first of all, let's look at how things have moved along for climate change. So initially, the climate change conversation was really started around air pollution. Yeah. So it never really addressed health. The language of health has never been in the climate conversation. So earlier on in this panel, we had a gentleman from Uganda, and I understand he's climate environment, isn't it? Is he still in the room?
Yeah, Bob.
Huh? Yes, there you are. I just have a question for him first, because this is how we start with advocacy. The question I have for you is, Dr. Ruth sitting on any of the tables when you are discussing climate? Because that's where the advocacy has to start. The advocacy has to start at the national level. When we talk about climate, it is only now that we're beginning to see that climate, the face of climate is actually health. At the end of the day, for a continent that emits less than 4%, but sees the impact beyond what anybody else sees, the question that we have to ask ourselves when we advocate is, looking nationally, are we even having the collective discussions with the right partners around the table? So I want to ask him first, before I even start, does Dr. Ruth sit at the table with you when you discuss climate? Is it yes or no? There you go. There you go. So on Sunday, we had a discussion with 5 ministers in the room. There were ministers of health and ministers of environment, because in order to do advocacy, every party has to be sitting at the table. There has to be a seat at the table for everyone that is in any way impacted by climate. We as AMREF deal with local communities, so we expect that local community voice sits at the table with us when we talk about climate. Githinji mentioned to you how Tanzania, Marburg was actually found by a community health worker. So the community voice is important, but more so on the political side, we need to make sure that health, environment, climate sit together. So when you are looking at your national indicators, you are able to actually include climate and health in the same sentence, right? So when we looked at climate, it was, to be quite honest, it was the first time we ever even thought about climate as AMREF in a concrete way was when we attended COP27. And when we went to COP27, what we found is there is no health pillar. And we said, well, how can that be? Is the story not clear? Are people not communicating? Is the evidence that my colleague here generating not being synthesized well enough so that climate and environment and health can always, can all read the same message? So for us, the advocacy has to start first in country. Are we engaging the right stakeholders? Who's at the table? Do you have community at the table? Do you have civil society at the table? Do you have all the necessary ministries at the table? And that is how we can actually turn that advocacy communication or the advocacy effort to be successful. So we actually leveraged what we knew at the community level, what we understood, not just nationally, but regionally and globally. And we said there is a message that is missing. And the missing message is that Africa actually bears the brunt of climate for things that it did not do. And yet we received the burden. And we said the first thing we need to do is talk about it. Talk about it in every setting, on every table, in every community, at every opportunity that we have. And so we said we need to bring climate into health. And I think unless we are able to do that, unless we bring health into the conversation of climate, we are really selling ourselves short. Because right now, the conversations even in this space, if you think about Africa Climate Summit, would you not imagine, it is unimaginable for me certainly, that health is not prioritized in this conversation, in this particular meeting. So I think for us, advocacy is really about get the right players around the table, talk about solutions that will work. I have a colleague here from Ethiopia. I think you're from Ethiopia, isn't it? Okay. I'm also from Ethiopia. Ethiopia did something very, very interesting called the Sekoka Declaration, where the leadership, so it takes actually leadership, right, came and said, we need every ministry to be involved to ensure in this area called Sekoka, there will not be malnutrition and stunting. Every single ministry from health, education, transport, and environment, all of the ministries got together and the leadership said, figure out a solution. And when you put the right stakeholders around the table, and not only did the ministry, the government say that, the government also said, figure out how you're going to work out your budgets so that everyone has a part to play in the solutions. And I think the first thing we need to do is, do we have the right people and all the people that we need in order to advocate effectively? And that's the first thing I would say about advocacy. And our success in advocacy is really being able to draw the right stakeholders to the table.
No, that's really, thank you very much. That's really interesting. And I'm hoping that one of the things that's going to come out here is really the fact that for Africa, health needs to be the face of climate change. Like you have rightly said, in terms of CO2 emissions, we don't contribute, but yet we are bearing the highest burden. And you have really raised really pertinent point around why is health not on the conversation, on the agenda of the summit this week. I'm also pleased to say that one of the things that's going to come out of this particular meeting is we're going to put together key recommendations that has come out from experts such as yourself, the panelists, the questions, and this is what we'll be presenting tomorrow at the high-level meeting that we'll be hosting at KICC tomorrow. So really, back to you at AFDB. And a lot of the conversations, I think money, I have to be honest, because every program intervention requires funding. So every now and then you have to think about how do we get the resources? I mean, you're dealing with several other issues. How do we get the resources? So I'm going to turn to you and say categorically, AFDB has been supporting a lot of health portfolios across Africa. What is the right messaging? Should scientists, countries represented, organizations represented, should we be seeking funding from organizations such as yourself? In terms of financing, what should our key message? How should we package climate change and health?
Thank you so much. I think I will start with the last question. Should we be seeking funding from institutions like us? I would say yes, because the Africa Development Bank is here for the regional member countries. And so any resource that we mobilize.
When I hear money, I get excited. A round of applause for AFDB.
Yeah, but I think it's important to get that message out. I mean, the number of situations where we have been asked, where do you get this money and what do you use it for? And I think for me, this could be the right platform to say the resources that the bank mobilizes, it mobilizes for its member states. anything that we do to promote, to support member states, and just making sure that they are addressing the issues that are affecting the communities within the continent. So yes, the resources have been mobilized for regional member states. So let's do that. In terms of health, you'll also be glad to know that two key things, two frameworks that we have established as the bank to be able to support health issues within the member states. One, of course, is the quality infrastructure strategy that we have set up. This, of course, defines what the bank can do and what the bank cannot do in as far as supporting the member states are concerned. And health is a priority. We've had our own experience, maybe everybody in here, of what happened during the COVID situation and the importance of working together, which has also been highlighted. But I think more importantly for us is also the aspect of taking ownership of our own issues and be able to find solutions. We have heard even from some of the speakers that we were at the receiving end when it came to vaccine. We were at the tail end because we could not produce. But what this quality infrastructure strategy for the bank is saying, can we do something about it? Let's not wait to a point where we are almost on the ground seeking for support and all the kind of thing, but that we start developing our own solutions and finding our own, identifying our own problems and finding our own solution. So the issue of health is an issue that affects all of us. And I think we need to take that leadership. I'm happy that the CDC is really, taking leadership in that. And for the bank, we've been supporting the work of CDC, but we are also supporting the pharmaceutical industry because of the experience that we've had. We are also working on supporting public-private partnerships within the continent. We do acknowledge that governments are really constrained sometimes with resources. We do acknowledge that, yes, indeed, sometimes we have to go on our knees to be able to get resources. But we're also saying, how do we take advantage and utilize, the resources within our government, within our continent, within our countries, supporting domestic financing, for instance, and putting up structures that will be able to mobilize resources and support our own solutions to our own problems. Thank you.
I just want to speak to that, if you don't mind. This is a chat, right? It's a fireside chat.
Let's go.
So if we were around a fireplace, I would just turn to my colleague and say, yes, AFDP should help, and she applauded, and we're happy. But the challenge is that how do you access that financing? You see, on Sunday night, we had ministers there, and the Minister of Malawi. She has been a very vocal advocate, the Honorable Minister Chiponda. She hosted us when we went to have a conversation with the group of Africa negotiators and other key partners to say, we need one common message to advocate for climate at COP28. We wanted to go to UNFCCC. So one of the things she said is, I just hear there is money around, I don't know how to access it. Every other day, she is struggling because there are climate incidents, and that impacts health. It impacts health facilities because we don't have resilient health systems. We have communities that are struggling. And so ministers of health that have not been invited to that table don't know how to access this financing. If you look at Green Climate Fund, for example, the way it's structured, it is not easy for a minister of health to come and say, we need this help. We need to build a resilient health system. That climate fund is structured and it operates on consensus. So if there's one person that disagrees, that funding is not dispersed. And you have to go through an accredited agency. What does that mean? So people, I think what we need to understand is there are all these financing mechanisms. There are billions of dollars in climate. Dr. Ahmed mentioned there is money in the system. The question is not about money. The question is really about how do we prioritize health? How do we ensure that the funding mechanisms are accessible to the teams that work on health or health research or whatever those might be? How can we make sure that at the end of the day, the community is accessing health and the resources? So I think we need to look at advocating for much more simplified solutions to financing. because right now there are many gaps. It is very complicated. And even our at ministerial level, they don't know how to access it because the language is different. So we need to actually build the capacity of our ministers of health so that they understand the climate discussion. We need to make sure that every one of them has a seat at the table. Our continent, we have to speak in one voice. You know, you can't, there's an Africa negotiator in every country. Every country has a negotiator. And the countries are going and putting forth their own requests. And our view is, unless we can come with a collective voice to COP and present to UNFCCC a common cause, and that is what we ended up doing actually. But in failing also, we didn't succeed. We thought we would just have a common position and we're all set. We're coming here to Nairobi, to the Africa Climate Summit. Things will be sorted. No. And through our failure, we also learn. One of my colleagues tells me, every time you fail, it's really an opportunity to learn, isn't it? And I think what we need to do is we need to say we already now have a position, a common position, and now we need to socialize it with all of our ministries of health, with our ministries of environment, and with climate, so that we can ensure when the Africa group of negotiators gets to COP28, they have a common message, and that common message could be financing around adaptation. We need to make sure that we include mitigation in that conversation. We need to make sure we include loss and damage. At the end of the day, what we really need to do is we need to ensure that health is a pillar in the climate conversation, and it's a finance working group.
Can I just comment before you come in?
Just never mind, we don't need a moderator.
Now they're going to have a chat. I love it.
It's a chat. It's a chat. So allow me to come in. No, I just want to compliment the aspect of, you know, two things for me. Capacity, that is very critical. I think we underestimate that. We would have information, but we don't have the right capacity to be able to either disseminate or act on the information that we have. And I think for me, this is what is happening even with the climate financing and so on. And I want to call it a mindset. It's a mindset that it's very difficult to get. But if you get people on the table and let them appreciate the process and what needs to be done, you'll be surprised how much that would be done. Secondly, it's also about collectiveness, like you have said. You know, how can we work together to make sure that we maximize on the resources that are available? Sometimes we want to go solo, and when we go alone, it becomes very difficult for us to secure. How do we then work together? On the aspect of the Africa Development Bank, one of the things that we do when we are engaging with countries is really ensuring that there's collective engagement, there's collaborative engagement with different stakeholders. But even with that, you find that they engage at different levels. For me, I think we need to work on building and strengthening the capacity of the stakeholders that are engaging in this process so that we benefit, because we are missing out. And we're being told lots of money is out there, nobody's able to access. You put in a proposal, they will tell you, you have not met the expectation. We should not be on the sideline. I think we need to get into the dirty water and just see how do we clean this up to be able to benefit from these resources.
No, really good insights from you both. I think we are really on the same page on that. So I'm going to come back to you because I know AFDB does host ministers of finance. How do we keep this message? One of the things that, I mean, the agricultural sector has been able to do is link it to the money. How can we link this message on climate change and health, One Health, when we come to the table at the AFD annual meetings where you bring all the finance ministers and they're talking money, they're talking policies? How do we, it's about bringing the topic to the table. How do we ensure that we are able to reflect it, particularly because we as health experts, we're never in the room with you, you guys that have a lot of money. So how do we ensure that we are on that agenda?
Two things. One, at least you're aware there's an annual meeting coming up. One of the things that we could do is to have experts in health to work with the experts in health within the bank and also make sure that we have an agenda on the annual meeting. When we bring in the ministers of finance, we should also make sure that we bring in the ministers of health, because sometimes you speak to Minister of Finance and Minister of Health is not in the room, the priorities do change because many other sectors would be in the room and also pushing on the agenda. So my suggestion would be, can we engage at a level where we actually even have a side event and talk about health and climate? And we need to start now because the annual meeting is just around the corner.
Thank you. I'm looking at Dr. Ahmed. It sounds like we are going to be having a side event at the annual meetings of AFDB. I think it's important that we take the amazing recommendations that have come out of this room and we really streamline what the priorities of Africa should be focused on when it comes to climate change and health. So definitely, I think our leadership is here. We'll be able to talk to the AFDB team. Dexter, you're very clear to say that Africa is still not on the table. There's a reason why health is still not on the agenda for COP28. But I know there are several other mechanisms we as African countries can take to really prioritize and bring the focus back to Africa. I mean, there are meetings like the annual meetings of AFD. The Africa Union has the Specialized Technical Committee on Health Ministers, Agriculture Ministers, STC. We also have the convening power at the level of heads of state and government. So my question to you is, should Africa be thinking about creating its own advocacy? When our heads of state are meeting, where ministers of health are meeting, is it a time for us to really change our perspective and not wait for us to be noticed by the global community, but really try to prioritize what Africa should be doing and focus on our political leaders within the continent?
Thank you. So maybe this might not be popular, but every leader has technocrats that work under them. So the most important step that we can take, I think, to push a common agenda is to ensure that the technical people that are working under the leadership, whether it's a presidency, a minister, etc., are well informed. Because when we have that, then we can have common conversations, or we can find points of intersection that we can all rally around. So the first thing we need to do, and we have convening, yeah, Africa CDC has convening, we have convening, the ADB has, everyone has convening. What is the point? In this room, everyone in this room has a common agenda, isn't it? But in this room, are there any young people? Is there anybody under age 20? How old are you? You've got a few. So two of you, please tell me, in your view, are young people engaged in the climate conversation? Because this is important. This climate issue will affect women and young people disproportionately. So how have you felt involved in the climate conversation? Go ahead.
Yep. I could go first. I think I'm in this room, so I'm already part of the climate conversation. But it has taken a deliberate effort from ourselves as young people to make sure that we are lobbying to be included in this conversation, because in a couple of years, we're the ones who are going to face this, to live within the impact of the climate change. The other thing is to have good leadership. In my own organization, I have been given the mandate to make decisions. I've been trusted to that the education that I got, the experience that I got is enough for me to make decisions that are relevant for the organization and for my generation. So I think there's a lot to be done, but there's something being done.
Okay, that's good to know. But I think, we often sideline the youth and we don't really integrate them into our conversation. Certainly, we don't have a representation of community in this room, I don't think, although all of us come from a community. So I think the first thing that we need to do is, first of all, have the stakeholders in the room. Make sure that the technical people that sit under the people who are making decisions at national level or even regional level are informed. So our goal right now is, what is our common message? We have a common position that we've drafted. We can certainly leverage that and simplify it so that people can align around that. But our goal right now should be, do the people who are actually doing the technical work understand the intersection between climate and health? Do they not understand that actually the cost of climate on health can actually be quantified? And there are people beginning to do that. And I would dare say that Africa CDC is in actually a good position to begin that type of research and that type of work to define how can we quantify the impact of climate on health? Because it does have a significant impact, right? So I think we need to find that common messaging. We are happy to share the common position that was drafted in Malawi, but we also want to call out to, very intelligent leaders in the health community that are in this room to help us also to deliver that messaging and ensure that all of the technical leads are informed so that the Minister of Finance, his technical person, understands that connection. So we need to translate those key messages for every audience. And that's what advocacy is about. Can I give you an example? So I don't know how many of you know Professor Miriam Wary. Yeah, she's a giant, right? She's a giant. And Professor Wary did something around water sanitation and hygiene. Many years ago, we were talking about how do we create sort of a defecation-free zone? How do we create toilets, and how do we engage communities to actually, have latrines? And what we realized is that in the communities in which we were trying to do this, there is this, other beliefs. There is a belief about, witchcraft, this kind of thing. And Professor Wary actually came out and said to them, look, if you leave, things around behind the bushes, that alone could be something that can be used against you. So we need to ensure that we actually hide our business someplace. And here's an opportunity, which is a latrine, right? And in doing so, we're able to now then encourage people to do latrines. Every community has the conversation for every community has to be framed in a way that they understand. And that's how you make change, right? So when we talk about behavior change, it has community work that's involved. And Miriam Wary made sure that people began to accept, latrines, and we began to build it. And then we said we need to be creative in terms of financing it, because water and sanitation is a big also element of climate change, right? So I think we need to be able to speak the people's language at every level.
No, I think it comes out clearly that the people are really the anchor of everything that we do as health experts, as global health experts in the One Health space in climate change as well. You wanted to say?
No, I just wanted to just compliment and say, when we talk about the technocrats who are supporting the policymakers in all the conversations that go on, I think it's important that we do checks and balances as a way of advocacy, so to speak, so that when they are getting into these conversations, they are informed by either the research that is being done or the experience that is going on in the community, and so on and so forth. Sometimes we miss opportunities, not because we don't have information, but maybe we miss the opportunity to provide the information that this policymaker should have to be able to guide the conversation and make the right decision. So for me, CDC, you have a big role to play there. You have opportunity to engage at various high-level engagement. But for me is, how are you packaging the information? Now we are talking of, climate is just, it's not responding, or is not talking about health. How are we preparing the information so that tomorrow when you go to make that presentation, you are not just speaking to the audience, but you have done your internal underground engagement to make sure that those key people who are actually informing the ministers have the right kind of information.
Thank you very much. And a big round of applause for my panelists. Thank you so much. As you can hear, we at Africa CDC, we definitely have our work cut out for us. But I think, I know that we are up to the task. You have seen us with what we did with COVID-19, and we remain committed to ensuring that we have a safer, healthier Africa. Thank you very much, colleagues. I'm now pleased to welcome Dr. Ahmed Ogwell to deliver the closing remarks.
No, these are not closing remarks because we are not closing anything. we are just beginning the conversation. So first, let me thank everybody who's been with us since the morning, at least here in the room, and those online, whatever the time zone is, who've been with us throughout this session. Very, very robust conversation, a lot of ideas, many opportunities are opening up, and I would really like to urge each and every one of us to take away something from today's session that we can be able to use to build the next session and the next activities, the next collaboration, the next partnerships. Let's meet, I'm looking at one day, in about a year, yeah? Because COP28 is a bit too soon. Let's meet early, maybe mid next year at most, and see how far we have come from the conversation we are having now until that time. And let's see if COP29 going forward is going to be different, is going to give us more in terms of bringing together all the different groups under one health approach to be able to address this very important nexus of climate and health. So I thank you. And a second thing, usually there are three things, but today there'll only be two. Mambo ni mawili. So second thing is, let's bring our institutions into this conversation. Meaning that when we go back, let's try and institutionalize the roles that our own institution can be able to play in taking this matter forward. If you're in the ministry, how does your ministry take it forward? If you're in Africa CDC, how do we do that? You're in an intergovernmental institution, non-state actor, how does your institution take this forward so that we ensure that we are getting more and more people engaged in this conversation of the nexus between climate and health. So ours from Africa CDC is to be grateful, and we encourage you, please invite us to yours. We will come and we will have a good conversation, but better still is let's do something concrete together. We have been challenged as Africa CDC, and we are noting down the things that we need to do, and we promise we will do our part, and hopefully you will do your part, and together next time that we meet, hopefully in less than 1 year, we can be able to share the steps that we have taken concretely to try and reach a better understanding of the nexus between climate and health. But more importantly for me is to actually take action that starts to reverse some of the problems that we are seeing. If we don't make this reach my grandmother, it has not happened. If you don't make this reach your grandmother, it has not happened. And if we don't make our communities understand their role, then it also has not happened. So I'm really looking forward to making it happen through our communication with our communities, our policymakers, our partners, and ourselves within our institutions. And together, let's meet in less than 1 year and compare notes where we are. I don't want to make any administrative announcements, but I heard whispers of something to, keep our mouths and stomachs busy immediately after this. So don't go. We will follow the lead of Shingai so that we know where we are going after this, and we continue the engagement and consultation and networking as we try and make things better for this continent of ours. If you're going to do it for the continent. Thank you.
Thank you so much, Dr. Ahmed. So colleagues, please join us downstairs on the first floor for cocktails. Just next to where we had lunch, there is a bar area, and there are cocktails that are set out on the terrace, and our networking dinner will start at 6:30. there is a meeting that's going to be held in this room. So if I can kindly request for us to migrate out quickly and continue our discussions downstairs. Thank you, everyone.